Hello friends, welcome to BLK Pediatric Practice. I am Dr. Shacchee. I am a pediatrician and an IBCLC and I work with BL Kapoor Hospital, New Delhi as a lactation consultant. So today I'm going to talk to you about infant feeding decisions in the times of coronavirus pandemic. As pediatricians, we all know the benefits that the breast milk offers. We know that breastfeeding is the optimal way to feed a baby and it is the optimum food. It provides immunity, it provides optimal growth as well as protection from all sorts of infections. So ideally, during these tough times, when the prognostic factor, the single most important prognostic factor for the COVID-19 disease is immunity, ideally we need our rates to go up. But surprisingly, when we looked at the preliminary data coming from all over the country, we found that the breastfeeding rates are steadily going down. This was a very alarming situation. This is a very alarming situation. And when we tried to look into the causes, we found that lack of knowledge about recommendations, both in the healthcare workers as well as the general population. Then lack of standard operating protocols, as in we knew the recommendations, but we did not have any standard operating protocols, and lack of manpower. So we knew recommendations, we had standard operating protocols, but we did not have enough manpower to support them. And last but not the least, lack of anticipatory guidance given to families when they leave for home after delivery or cesarean. These were the three important causes that were accounting for majority of the downfall in our breastfeeding rates. Let's look at let's have a look at the recommendations. So WHO, UNICEF, BPNI, FOGC, ILCA, CDC unanimously all say the same thing. Do not separate mother and baby. Initiate earliest skin to skin contact, initiate breastfeeding at the earliest, and even when the mother is COVID positive or suspect, continue the same. Just in those cases, teach the mother about careful hand hygiene, about how to wear a mask properly, and how to keep the surfaces that she touches clean. Rest all the guidelines remain same. Have a look at two of the WHO infographics. It says close contact and early exclusive breastfeeding helps the baby to thrive. And if a woman with COVID-19 is too unwell to breastfeed, she should be supported to safely provide her baby with breast milk in other ways, including expressing of breast milk, relactation, and donor human milk. So basic idea is telling everyone, the family, about importance of breast milk breastfeeding and the significance of immunity it provides. Now, the commonly encountered scenarios in our day-to-day practice in hospitals as well as private clinics are a few, like babies born to a coronavirus positive mother. Now, if the baby and mother both are fine, they do not need any extra hospitalization. If the mother is okay, asymptomatic or has mild symptoms, both mother and baby go home on breastfeeding. Suppose the mother is sick and needs ICU care. So it is very important that the mother and the family as well as the team taking care of the mother, they need to be taught about how to correctly express breast milk, how to store that breast milk, how to handle that breast milk, and how to transport that breast milk for the baby. In case those situations where the baby is sick and has been shifted to the NICU because of some prematurity or any other reason, then also the family needs to be guided in the same things: expression technique, frequency, storage, transport, and all that, so that mother can maintain her milk supply in the absence of direct breastfeeding. Then a common situation that we encounter is a breastfeeding mother, she becomes coronavirus positive. So she was negative, she was breastfeeding, and one fine day she is positive. So what we see is the family gets really panicked and they say we want to separate the mother and baby. We do not want the baby to catch infection. It is very important to make them understand that mother is coming from the community. Mother is living in that same family where we are thinking of separating and keeping the baby. Right. So who did the mother catch the infection from? Maybe the family who's at the moment symptomatic, but maybe will become symptomatic in a day or two, or the community. So if the baby stays with mother and mother follows masking and hand hygiene, there is lesser risk of transmission of coronavirus, but we are sure that the mother's milk will provide antibodies against coronavirus to the baby. So it's a much better situation than when baby is in the community, equal risk of getting infection and not getting antibodies. Then we also encounter situations wherein mother with a few week or few month old baby comes and gives us a history that she could never initiate breastfeeding because she was coronavirus positive during the time of delivery. The place where she delivered did not have proper protocols in place or did not have enough manpower in place to help her with initiating breastfeeding. So now that kind of mother comes, depending on the duration for which the breastfeeding had stopped or the duration for breastfeeding was not done, we can help her with initiation of lactation. It is, the term is relactation, and any skilled lactation professional or breastfeeding counselor can guide her into that. So if you have someone in your hospital or in your practice, please refer the mother to that person. Here is a decision tree given by WHO for the current times. So if a mother is suspected or positive, if she is not suspected, she is not positive, things go as usual. But if she is positive or is suspected of having coronavirus disease and she is well enough to breastfeed, immediate skin to skin contact, earliest initiation of breastfeeding, support with day-to-day issues of initial days of breastfeeding, that's done. If a mother is not able to directly breastfeed, suppose the mother is sick and is not able to directly breastfeed, she is able to express, then she is helped with that. Suppose the mother is neither able to breastfeed nor able to express, then the third option is donor human milk for the baby if that's available. Suppose that's also not available. Then the fourth option is wet nursing. So if that is available and also if that is acceptable to the family. If none of the above measures are applying here, then the last choice is formula, which is simply put human milk. So as soon as the mother's issues start settling, if the mother was having issues, baby is to be put on the breast if it was not being done before. And mother needs to have some kind of phone number or handout or appointment details where she can reach out for a teleconsult session or for a phone consult session wherein she can seek help for her breastfeeding challenges. In those situations where the mother never did initiate breastfeeding, she is helped in initiating breastfeeding and with relactation. Now, some practical tips so that we can give better breastfeeding outcomes to our families. We need to ensure that there is some assigned person in the labor rooms and OTs who can initiate earlier skin to skin contact and thus avoid separation. Then ensuring availability of skilled breastfeeding support nurses in the hospital who are trained in the practical skills, who can help the mother with the initial hiccups during breastfeeding, during her breastfeeding journey. Then ensuring that the family knows when, how, and who to reach out to for breastfeeding help. For those babies who are in NICU, the families need to go home with correct expression technique, with details about the frequency with which to express, the duration for how long to express, how to store that expressed breast milk, and obviously how to transport that milk from home to the NICU. And lastly, those moms who were not able to initiate breastfeeding, they need help and support with relactation with some skilled lactation support person. That's it for today. Thank you.